Hi friends, how are you all? I'm Dr. Yusuf Chunawala, pediatric dentist and bad breath specialist. Now, most of us go to a dentist and get our treatments done. Now, what happens is that after the treatment is done, there are a lot of instructions or care that has to be taken. That is called as post-operative care. Many a times after the treatment, especially when we are taking our kids, when the kids come, the parent is unable to communicate, or the child is making either a lot of noise or troubling, so the parent is unable to listen to all the instructions correctly. And this happens with the adult also. So somebody is on the phone, somebody gives a call. So what happens? The most important and critical aspect is the post operative care. So I am preparing a series of videos where I'll be talking about various post operative instructions after various dental procedures. Okay, and I'm going to talk in four languages, that is Hindi, Marathi, Gujarati and English. Now in today's lecture we're going to talk about what care will you take after a local anesthetic injection. See friends, whenever you are undergoing any dental treatment, or the child is undergoing any dental treatment, local anesthetic is very commonly given. This injection is very common. We are a little different in our clinic. We do not give this kind of injections. We give something called as STA, that is single tooth anesthesia. This is a special painless anesthesia machine. Now, though our anesthesia is painless, the post-operative instructions will remain the same. So now the first basic instructions is that you should not eat, drink or drink at all for at least 2 hours after you have been given the injection. Okay, because what happens, that particular area becomes numb. If it is the lower jaw, it is the lower lips, okay, it is the tongue and the cheek that becomes numb. And if it's the upper jaw, then it is the cheek and the upper lips that becomes numb. So what happens is, if you eat, there is immediately post your dental treatment, there is a possibility that you might bite on your lip, cheek or tongue, and that might cause a small injury, that might cause minor irritation, or sometimes you might bite little more and it will cause swelling and discomfort in that area. Generally no treatment is required. Even if there is a swelling or an ulceration, it heals up within 7 to 10 days, and all you have to do is apply Vaseline. And of course, as the anesthesia effect is wearing off, there might be some amount of difficulty in opening and closing the mouth, but this gets corrected on its own in a day or two. But if there is too much discomfort, you can always take a analgesic, okay, like maybe a combiflam syrup or ibugesic syrup, whatever as prescribed by the dentist. Now this is the basic care that you have to take after a local anesthetic injection. And if you feel there is something more to it, there is genuine difficulty in opening the mouth, because see, sometimes the injection is given inside the tissues. There might be something called as trismus, which persists for a longer duration. Trismus means difficulty in opening the mouth, and if this persists for a long time, get in touch with your dentist. So calling up your dentist is mandatory as soon as possible if you find something normal not happening. So thank you so much for your precious time. In my next video, I'm going to talk about all the instructions and care that you need to take after you have got your tooth removed. Thank you so much.